All right, so let's move into the Group Platinum Blue Plan. The Group Platinum Blue Plan, as you see in parentheses, it says cost. And your current plan has that same exact terminology following the plan name. It is the exact same type of Medicare contract. We contract with the Centers for Medicare and Medicaid to be able to offer these health plans in the state of Minnesota. This type of plan with Blue Cross and Blue Shield, I can assure you, is an open access network. We have over 95% of the Minnesota licensed doctors. We work with the Lina clinics. We work with the Park Nicollet. We work with Fairview. We work with North Memorial Clinic and North Clinic. We work with the Health East system. We work with Mayo. So many of the doctors and the doctor systems that you've grown accustomed to, you will be able to continue to receive your care through those same great doctor clinic systems. We also provide 100% coverage on the hospital network, except for veterans, because the Veterans Hospital is a separate contract with the federal government. So there should not, and I say should not, because you never know, there could be the one exception. But again, I have worked in transitioning many retirees to these plans, and I have not yet run into a situation where somebody is upset because they are not able to continue care with their doctor. And I genuinely want to share that with you because that is important. If it was my mom or dad or my grandma or my grandfather, I would want to make sure that that transition was going to be easy for you as well, as it is what we're hoping for. The travel benefit we do offer you allows you to travel up to 9 months per year. This is going to be a nice thing for you. You do not need to call. So today, every time you leave the state of Minnesota, can't speak for the current carrier, but with Blue Cross and Blue Shield, you don't have to call us. When you leave the state of Minnesota, you make sure you present your Medicare card and your Blue Cross and Blue Shield of Minnesota medical card, so the Platinum Blue. And your benefits will be provided up to the benefit level that I'm going to describe here in a moment with any Medicare contracted provider. So as long as that provider is willing to service you as a Medicare beneficiary, we will treat that claim as if you're right here in the state of Minnesota receiving the health care. We provide worldwide emergency coverage, which means if you travel outside the United States, Medicare doesn't pay on anything, but Blue Cross and Blue Shield of Minnesota will. And we will pay everything but a $50 copayment for that emergency. Preventive care we talked about. We also have some value-added services like a 24-hour nurse advice line. Great service. It's available 365 days a year. And you can talk with a registered nurse about your concerns. We also have a Silver Sneakers program. And we truly believe it is important. And we will continue to pay your health club membership. If you're not currently seeking or using the Silver Sneakers program, I encourage you to look at it and consider it. And I'll show you a few of the facilities nearby. Will you need to sign up with your facility again? Yes, you will. You will need to present your Platinum Blue ID card so that that facility now charges Blue Cross and we pay the facility for your entire month's membership. That is a good question. Thank you. We do work with the Health Partners clinics, yes. Yes, and we have some resources in the latter part of this PowerPoint that I'll show you that will give you some points of location to check things as well. We offer you $125 on your eyewear benefit, non-Medicare covered eyewear, every year, and we also will offer $450 towards your hearing aid benefit each year. Now for the Platinum Blue plan, you must have Medicare Part A and Part B. You must continue to pay your Part B premium. And this is the most important one. You must be a permanent resident of Minnesota. And I think all of you meet that criteria. The next point, if you have end-stage renal disease, we will talk with those individuals one-on-one and make sure that you have coverage. But for the Medicare cost contract, if somebody is not currently part of our health plan and they currently have this particular diagnosis, we are not able to accept that enrollment. However, we will enroll that individual in the Senior Gold Plan. So everybody will be guaranteed issue regardless of your current health history. The only thing we require is that you have Medicare Part A, Part B, and you're a resident. You have a quick question in the back? Okay, so the comment being Fairview is not connected with Unity. Well, what Maple Grove is in the network. So the North Memorial Hospital System in Maple Grove off of 94 is participating. Can you still go to Unity? The answer is yes. And sometimes, just to your point, if your doctor is directing care at a particular hospital system and they change that hospital system, that can happen, and you would be covered at either hospital system. Yep. And that happens because we can't choose where our doctors want to do surgery. That would be nice. It might be more convenient to go to Unity, but that doctor may have a different sort of contract with North Memorial. So it would still be covered at either system. All right. So the group Platinum Blue, Plan B, this next snapshot shows you the benefits we are providing to you. And again, with this plan, it is a very rich coverage option. There is no deductible. Deductible means there's nothing you have to pay up front before your benefits kick in. But if you do go to the office January 1st or you end up in urgent care, and if it is related to an illness or an injury or you're treating a medical condition, you will have a $15 copayment. This is positive news for you because today you're paying $20, correct? So that copayment will go down. You have Will they ask for that payment when you go in? They may ask for that payment when you go in, yes. Usually with a copayment type plan, you pay your copayment up front. If it's a coinsurance, which means a percent, which for the durable medical equipment up here, you see there's a coinsurance of 10%, they potentially would bill you on the back end because you would be paying 10% based on the Blue Cross contracted amount, not on the billed amount. Now, a provider cannot deny you access or deny you receiving your services if you don't pay your copayment. That is a Minnesota state law. So just be familiar with the fact that if you, for some reason, don't have your checkbook, you don't have the cash on you, you really need to see the doctor, they cannot deny you the access to medical care. Preventive services are paid in full, inpatient paid in full. Emergency room copayment will be $50. If you're admitted into the hospital, that would be covered at 100%. And it would have to be coded as an inpatient hospital stay. And then durable medical equipment is 10%. Now this is a snapshot. For those of you that have the enrollment folders, we do have quite a bit of information on your plan in the enrollment folder. And that information will be on the left-hand side of the folder. Behind the enrollment forms is a nice little cover page that shows you the benefits in more detail, and then we have a summary of benefits. This summary of benefits reads like the summary of benefits you're used to. We all follow the same sort of format, and it's required. So it makes it easier for you to understand what the transition means. So again, this information is available. I know a lot of you picked it up. We didn't put all of the benefits up here, but it's still the same great comprehensive coverage you're used to. You will see that there is an out-of-pocket maximum of $3,000. Now that is a change from where you're at today, and the county was comfortable with that change. I don't think very many individuals hit the out-of-pocket maximum. So you have a great plan. It's going to supplement many of those deductibles and coinsurances that Medicare doesn't pay for. Silver sneakers, we talked about it a little bit already. We're pleased to say that we include that as part of our program, and we will continue to pay your whole entire month's membership at the participating clubs. You can attend the classes. You can attend, you can use the swimming pool, you can walk around the track, and any of the other amenities in the facility, you have access at no cost. But if there is a cost to a particular class you want to attend, like a Zumba class, maybe you want to learn the Zumba, and if there's a cost, you will have to potentially pay that. But your monthly membership, you show your Platinum Blue ID card. I'm going to show you what the Platinum Blue ID card looks like in a moment. But we will mail you, or Healthways will mail you a Silver Sneakers ID card once you enroll in the program. And it's a great time to meet people and do different activities. I hear nothing but great things. This program started in Minnesota in 1995, and it has grown strong. And I know it is an important piece for our Medicare population. Silver Steps is available for those individuals who do not have access to Silver Sneakers. So if you are living in a more rural part of Minnesota, you can order up a Silver Steps bag, and it will help you introduce some exercise in the home. Now, anytime you start a fitness program, we do encourage you to talk with your doctor to make sure that you're in a condition that allows you to do a fitness program. That's really important. You have a question? So the question is, if you were prescribed rehabilitation at a hospital system and you seek the rehab on an outpatient basis, if the doctor orders up the rehabilitation, which does have to meet the Medicare criteria to be covered, you would actually have the $15 office visit copayment for each time you go for your outpatient physical therapy or speech therapy or occupational therapy. With any rehab program, there is criteria that has to be met. And if you hit a point where the functionality of what the rehab is trying to accomplish in terms of the condition, if you reach a plateau where your doctor's not seeing any sort of improvement, they may technically say, you've hit your plateau, you can continue the rehab, but you can do that at a cost. Will Silver Sneakers pay that cost, or will Blue Cross and Blue Shield pay that cost? No, not at that point. If you hit a point where you're being told your rehab is no longer going to be covered, you will want to try to maybe look at choosing a fitness facility. And Silver Sneakers is awesome because it's a low-impact workout. It's a workout that actually has chairs. It focuses on improving your strength, improving your flexibility. They use those flex bands. It works on your agility. It works on balance. And so there are different parts of this program that truthfully I've heard some great testimonials where individuals, I can remember working with a city where firefighters had difficulty raising their arms because of all the heavy equipment they carried over the years. And this program actually put a little health back into their life. They could actually get to the point where they could reach up and grab something. So that's a conversation you want to have with your doctor, for sure. Here's a listing of some of the participating facilities. I actually did the surrounding area here. You can go on to silversneakers.com. If you're internet savvy, punch in your zip code, and it's right on the front page there. Punch in your zip code, and it will pull up all the participating facilities near you. So Anytime Fitness, nationwide, Studio K, the YMCA in Andover, Elk River YMCA and all the Women's Curves. And it's a national program. So if you go to Arizona or Texas or Florida, punch in the zip code. If you're staying at a hotel and you have access to a computer, go pull up silversneakers.com, put in the zip code, show your Platinum Blue ID card, and we'll pay the entire month's membership. And you can be at more than one facility. So if you like Women's Curves because it's a great workout, but you want to go to the YMCA and use the swimming pool, you can do that. The YMCA in Coon Rapids is in there. It probably didn't pull up. I don't, for some odd reason. Yes, YMCA. Snap Fitness, we do work with many of the Snap Fitness as well. You know, I don't know all of these off on the top of my head. We do have Blackberries, our little telephones. We can punch in the program, and we can check that after the meeting. So if you have a particular facility, let's talk after the meeting. Yes, sir. Yep, when you enroll in the plan, you're actually going to receive this card that you see on this slide. And so when you first go into the facility after January, you show them the Platinum Blue ID card, and then shortly thereafter, within 2 to 3 weeks, you will receive a Silver Sneakers ID card. Once they have you set up in their system, you probably, well, I think you do, you have to swipe it each time. But, because we do go by the number of visits. But yeah, you just show your Platinum Blue ID card, and then we follow it up with the Silver Sneakers ID card. Is there a required minimum number of visits? No. So no minimum. You can go as little as you want or as often as you want. So comment or question, can you go to more than one facility? The answer is yes. You just show your Platinum Blue ID card to each of those facilities that you want to go to. So real quick on the enrollment form, and this is required, we have to take the new enrollment forms. We can't just enroll you. But at the very top in that gray box, there's a little spot that says group number. That's where you're going to put the group number, 0YR0330PB. Your effective date will be 1/1/2013. And then if you really want to help the county out, just put Anoka County on the top line. It'd be less work for the gals here. Now there is a lot of different information. We are going to have enrollment forms that will focus specifically on the applications. If you have particular questions you want to ask or you want to leave your forms today, let's take care of those after the meeting so I can be respectful of time, because I do want to get into the prescription drug plan. The one thing I do want to note is on number 1, Platinum Blue, it says Group Platinum Blue, and then that last page is where you sign and date. Okay, make sure you sign your application. Date, you know, we can still process it without the date, but make sure you sign it. Because if you don't, we're going to have to send you a letter asking you for your signature. So that's Platinum Blue. And again, this information is all on the left-hand side of your enrollment kit. The very last piece in that kit, you'll see there's a flyer on Silver Sneakers, so that if you want to call Silver Sneakers and ask questions, you can do that. They're prepared to take those calls. All right. I'm going to keep things moving along, and here are some resources. For the Platinum Blue, for the medical plan, you can go on to bluecrossmn.com. If you go to mybluecrossmn.com, you can sign up as a member, but you're going to wait until you get your medical ID card. But in the time being, just take my off and do bluecrossmn.com, and you will be able to see our provider directory out there for Platinum Blue. You also will see loads of other types of information, but the hot button for the provider directory is in the lower left-hand corner. It's called Find a Doctor, and then you just, when you get to that next page, you select Platinum Blue. We do have a customer service. I am going to ask that you hold on calling customer service until you get your ID card, because if you call them before you actually are in the system, they're not going to know how to respond to your questions. Everything we do when it comes to health benefits, we service over 2 million members. And as a health plan, we have to make sure we're giving out accurate information. If your information is not entered in the system, there's nothing for the service representative to validate, and so they won't respond to the question. That's why we're here today. That's why we have all these forums coming up. And you will get your ID card probably, it'll be the middle of December. We're working very closely with enrollment right now, but we expect to start taking enrollment forms December 1st for this plan. So it'll take a couple of weeks for that ID card to get out to you. And you will receive a letter from us that tells you we have your form, it's being processed. All right. I'm not going to spend any time on Group Senior Gold today. This is information that I'll let you read through at your own, on your own. It is the plan for people who are permanent residents outside Minnesota. Rest assured, if you move, you have a plan. You have a medical plan that will go with you. It will provide complete coverage nationwide. It's a fitness discount of $20. And with the Senior Gold Plan, basically these people, which is very few retirees, they're going to pay $147 and then 100% coverage. But we needed to have a plan to accommodate people who live outside the state of Minnesota.